Good morning. Good morning again. Welcome to the 9:30 call here on Monday, January 27th. It's good to see folks. Kim, I see you're here. We'll give folks a minute to join. Um, and as folks saw in the 9:30 call calendar for this week, today we are so happy to have Kim Dion with us. And then tomorrow we are going to hear from Stephanie Heron Rice and David McKenna, who are at the Greater Boston Legal Services. They're going to talk about paid family leave, and they sent some links that I added in the calendar invite. And then on Wednesday, we are going to hear from Liz Sweet, who's the executive director at the Massachusetts Immigrant and Refugee Advocacy Coalition, which is MIRA. And we continue to get questions from folks. So if you have questions, specific scenarios, you can send them to me. We are going to have Excel linguistics that day, so we will have translation. So we're excited to have that resource available. So please tell folks that that is happening. We will record it. And then on Thursday, we're going to hear from Jacques Payton, who is the founder and CEO of Nubian Square Investments. And he has been working through the United Way of Mass Bay, and he's been working. They helped advise a group of family childcare providers to learn, develop, and put in place financial plans and retirement accounts based on their short and long-term needs. So quite a week here on the 9:30 call, which, as you know or don't know, will be celebrating its fifth year on in March. So we continue to have this resource and this community, which we're so grateful for. So please, we're continuing to send out the calendar and just make sure people know what resources are available. So anybody is welcome in the 9:30 call. So please help us be good ambassadors of that information. Kim Dion, I will turn things over to you. I know you have slides, which we will post in the 9:30 call follow-up folder, which is organized by year, so you can always find the slides there. And then we also have our YouTube channel playlist of the 9:30 call. So we are recording today, and that will be available as well. So Kim, I will turn it over to you. And the first question, as you know, is for you to tell us a little bit about you and how you came to be in your current role.
Sure. Thanks, Amy. I'm Kim Dion. I'm the Assistant Vice President for Seven Hills Child Care Resources, and I'm here representing the Massachusetts Child Care Resource and Referral Network. I want to say a couple of my colleagues are on as well. Kelly Graceffa, who's the Program Director in Boston, and Corinne Corso from the Child Care Circuit up in Lawrence are here as well. I got into this field 37 years ago. I went to school at Quinsigamond Community College in Worcester at first and thought I wanted to be a preschool teacher. I learned very quickly I did not have the patience to sit all day in a classroom with little ones, but loved the field, and this turned out to be a perfect fit for me. My particular program, we manage the child care resource and referral for Central and Western Mass. We have 5 offices. And I'm sitting in Worcester, but we have offices in Fitchburg, West Springfield, Greenfield, and Pittsfield as well. All right. Amy, do I have the ability to share?
You should. Now, Kim, who are you rooting for in the football playoffs?
No one.
I see. Okay. Serious.
I'm having technical difficulties.
Let me see.
Oh, here we go.
You got it?
I do.
Maybe as Kim's getting started, if you are rooting for somebody in the next level for the Super Bowl, please add it to the chat. Oh, Amy. You are Brian.
Okay. So, first of all, who are we? The Mass DCR&R network is comprised of these 6 agencies. My friends at Child Care Choices of Boston and Community Cares for Kids manage the Metro Boston area. Child Care Circuit manages the Northeast. And the folks at Child Care Works and Child Care Network work on the Southeast, and then Seven Hills covers the central and western part of the state. We attached this map, and it's got phone numbers and contact information for all of us. And we love this map. It's got we can actually read all of the names of the towns, which you can't always do in some maps of the state. So if you're unsure who your R&R is, you can take a look at this map. First thing we wanted to talk about was the wait list, because there does seem to be a lot of questions about the wait list. We know there's more than 29,000 children on the wait list. It's a big number. All of the R&Rs manage the wait list for our own service delivery area, and we're all at a different month on the wait list. But generally speaking, there are folks on the wait list for about 2 years at this point. There is priority access for early educators, for homeless, families experiencing domestic violence, young parents, children with special needs, as well as families with substance abuse. But please note, priority access. It does not mean immediate access. It means you get to jump up on the wait list so that when there's funding available, you'll get a letter from us. I know when the commissioner was on last week, she talked about EEC serving more children than ever before. That's certainly true. And it really is a great thing. We've never had this many kids that we've supported through financial assistance before. But the downside to that is we don't anticipate the waitlist being opened up for at least the remainder of this fiscal year, which would end on June 30th. There may be some movement because contracted programs that contract directly with EEC for payment, they might be reaching out to families on the waitlist if they have open slots within their programs and they need to fill them. DTA and DCF funded children do have immediate access, and they are accessing care at higher rates than ever before. So for families that fall into those categories, whether it's DCF or DTA, they do need to get a child care referral from their social worker at either DTA or DCF. Generally speaking, those agencies would send the referral directly to the Child Care Resource and Referral Agency. As soon as the CCR&R receives that referral, we reach out in multiple ways, phone, email, snail mail, to let the family know we've received the referral and to find out if the family has childcare secured. If they have childcare in place, then we book an appointment to put the childcare voucher in place. And this can be a two-step appointment. The first one, to collect the documentation as needed and enter that authorization. And then the second one would be to enter the actual placement, and then the child would be ready to start. Sometimes it can be done at the same time. That tends to be CCR&R specific and can vary depending on the circumstances. And for these families, there is minimal documentation. Generally, it's a picture ID along with the referral from DTA or DCF and EEC forms that need to be signed. All the R&Rs have access to an electronic signature program, and most of our appointments are done via the phone. Occasionally, families prefer to walk in, or they might want to do something like this, a Zoom appointment, and we certainly can accommodate whatever the family prefers. Now, if they don't have childcare secured, then the families are sent to our information and referral staff. All 6 of our programs have specific staff who are trained, and their primary job is to generate a list of programs that's tailored to that family's specific needs. And if they're looking for a child care voucher, then it's a provider who accepts financial assistance through our programs. The family also will receive information about what to look for. You all know, families don't know what they're looking for, especially if it's their first time using childcare. So we try to give them some tips on what questions to ask, maybe some quality indicators, things to look for when they're searching. It's pretty much the same process if it's a DCF referral, only the referral comes to us from DCF. Once the family finds a child care program, then we go to the appointment. So all told, when we get the referral, if child care is in place, hopefully we could get this processed in a week or two. Certainly there's busy times of years like June, when you've got all the kids that are transitioning from academic year programs to summer camps, or when they're returning back to the academic year programs at the end of August into September, where things can get a little bit backlogged with appointments. There's also immediate access for families that fall under continuity of care. Continuity of care is sort of an umbrella term, and it can mean siblings. So if there's a preschooler that's got a child care voucher and the family's got a school age child that doesn't need care during the school year, but they might need care during the summer, that child is considered continuity of care and can access care for the summer. Or maybe they've had an infant who's been being cared for by family. They didn't want daycare while the child was a baby, but now the baby's turning into a toddler, and now they would like to look at formal care. That's continuity of care, as long as there's another child in that home accessing services. If a family leaves their voucher, right now, the rule is you have 60 days to return to care. That is a rule that can change. Pre-COVID, it was 30 days you had to return to care. Right now, it's 60 days. And I know EEC is working on making some changes, and I'm not sure if that will change. But right now, it's 60 days, and they can come back in. And also, if you're a DTA or a DCF family and you're getting out of services through those organizations, you're no longer eligible for a referral through them, we can transition you over to income eligible. So that would also be considered continuity of care.
And so, Kim, that was a lot of information. And I think what the highlight is there are different ways, for financial assistance to flow from different funding streams with different eligibility requirements. And so if you hear something about one part, it doesn't necessarily mean it's true for all parts. There
Yes.
is a question in the chat from Naomi, and it looks like Kelly is answering it. Do the CCRNRs have access to data on which programs actually have openings at any given moment? And then Kelly has answered it in chat. Also, just want to
Thank you, Kelly.
acknowledge, Kim, that we have 117 people on the call this morning. So it's good.
Nice.
It's there.
Good way to start
Okay.
the week.
Yes. Keep going, Kim.
Okay, so we've had some folks ask about where are the kids and what kinds of programs do they use, and you can see the breakdown: 71% center-based, 29% family daycare, and then by each of the CCR&Rs. We also have been receiving questions about billing from providers. So we wanted to go over the way providers bill, because there has been changes within the last year. Currently, all of the R&Rs have 2 billing windows every month, but each provider can only bill once a month. So if your billing submission's in by 5 p.m. on the 9th of each month, you are going to be in what we call window 1. So after 5 o'clock on the 9th, we have the next day to process the next business day to process the billing with EEC. And then EEC has made a standard of within 5 business days of them receiving the submission from us to have payment to the CCR&Rs. I can assure you that all the CCR&Rs always have payments ready to go. Once that money hits the CCR&R, it immediately goes out within usually the same day to the child care providers. If the 9th falls on a Friday, and there's a weekend, remember, we're not processing till Monday, so it's 5 business days from the Monday. Or if the Monday is maybe a holiday, we wouldn't be processing until the Tuesday. Window number 2 is for submissions that come in after 5 o'clock on the 9th and before 5 o'clock on the 20th of each month. Again, same process. But just want to be really clear that programs can only bill once a month. So if you bill window 1 and you find, oh, I forgot something or something changed, that would be an adjustment the following month. We can't rebill your program in the second window. We do want to acknowledge that there was a problem this month. There was a technology glitch in the CCFA technology. I can assure you that EEC was working around the clock. It was priority 1 for them, but all of us did receive payments significantly later than we typically receive from the folks at EEC. Hopefully, things are fixed now and we won't have that problem moving forward. Generally speaking, this is an anomaly that happened for December's payments that came out in January. We also wanted to touch on rates. Prior to just very recently, the Commonwealth used to require that whatever your lowest rate was, so if you had a family where there was multiple children and you were offering a discounted rate, whatever the lowest rate you charged used to have to be the rate that we paid you. That is no longer the case. So this new rule allows you to offer discounts or scholarships as you see fit, and we will always pay you the rate for your region. We want to acknowledge that there's $22.5 million in rate increases that are approved for fiscal 25. And that's on top of 60 million last year and 80 million the previous year. So if you have not checked in with your CCR&R recently, call us. We'd love to talk to you. The rates are very different than they were just 2 years ago. And it might be something that you'd like to take a look at for your program now. The new rates that the board just approved at the last board meeting puts more money towards infant rates across the regions. And it also looks at the 4 regions that were the farthest away from the actual cost of care and gave those regions a little bit higher bump. Same thing with family child care. They put more resources towards family child care over age 2. And then there were 3 regions that were further away from the actual cost of care. Just a note that the family child care rates, although they were approved by the board, they still need to be ratified by the union. And then to take a look at the actual rates, you can see, and for example, Region 1, 2, and 5 all have the same rates, and that's going up to $105 for infants and $82.50 for toddlers. Those are significant increases over what we had been paying, but you can see it's still just about close to 80% of the actual cost of care. And I will say EEC's done such a good job of trying to work with the federal government and change the way that they pay providers. Previously, it was based on market rate, and we all know that the market rate is based on what the families can support, and as opposed to cost of care. So this is a much better way of doing business, and we're so appreciative to EEC for looking at this. You can see the difference between fiscal 24 rates and the proposed fiscal 25 rates. And then for the family child care rates, and again, the rates that are shaded were the ones that were given that little bit more bump to get the rates up a little higher because they were significantly lower than the cost of care. And then this is the rate year over year. So from fiscal 24 to what we're proposing for fiscal 25, or what EEC is proposing for fiscal 25, pending ratification from the union. And then lastly, we just wanted to leave you with the program directors' names. You have all the contact information on the map on the earlier slide. But all of these program directors have been around for dozens of years and are really competent leaders, and really feel free to reach out with any questions that you might have. And that's happy to take questions.
All right, Kim, that was a lot of information. I've already posted the slides. Kim sent them to me last week. So we know, especially the ones that had all the numbers, were hard to see as we were going quickly.
Yeah.
So there's definitely some questions in the chat. Thank you to Corinne. So there was a question, and Kelly, about what do you have access to? And then programs have to update their information with the CCR&R, while the CCR&R's outreach to programs to try to have the most up-to-date information on vacancies. It's up to the programs about how current that is. They can also update their own information online, as all have access to their own programs via the portal. And then Amaris wonders, good morning, Kim, and thanks for being here. Can you say a bit about how CCR&R's contract administrators' rules overlap with the difference in how they interact with the wait list, or are there multiple wait lists for vouchers versus contract holders?
Sure, there is one state wait list. So the programs that are contracted with EEC directly use the same wait list that the R&Rs use. The difference is we would search for our whole region, and basically we're not looking for a specific prototype, whereas a contracted provider is going to go in and say, okay, I need a child that is toddler age, and my program is in Worcester, and my zip code is 01603, so I'm going to now narrow this down, and they're going to go in and search. So it's not necessarily the first name on the wait list that gets the letter. It's the first name on the wait list that meets the contracted provider's criteria.
And then somebody asked about the rate increases. Once ratified, they will be retroactive to July.
Yes, thank you for mentioning that. I should have had that on the slide.
That's So I think a little bit of like the structure of how things works, because there is a question from Ellen, if no more folks on the income-based wait list will get vouchers this fiscal year, when will we know about next year? And this is the critical question where we sit here on January 27th. So we are right now in fiscal year 25, right? And it makes sense now because we're in actual calendar year 2025. So, as we know, Governor Healy just released last week her budget proposal for fiscal year 26. So, that will start in July. That budget process determines how much money EEC has to spend in these different line items, which then impacts how much money the R&Rs have to work with. So it's a long process, but it's the legislature tells EEC kind of how to spend it and how much to spend, with a little bit of a caveat because we know a bulk of that money for subsidies and financial assistance comes from the federal government. And so we also know, kind of in hearing from Danielle, right now there's Congress is working to pass a continuing resolution. There's a new administration. So if you probably spent more than 5 minutes thinking about this, it might feel very unsettling to think about what the financial future is, not just for the Commonwealth, but for the country, because there are so many moving parts right now. But this is why it's important that we understand this first. The department has been really making this effort to increase rates and to think about across the board rates, but then thinking about, we know infant care is more expensive to deliver. We know some of the rates haven't been adjusted. So just like you're all trying to do in your own programs and in your personal finances, if you have X amount that you have to spend, there are some strings about how you spend it, and then thinking about what that budget is going to look like. So, I think that's why first understanding like where the money is in the process, like Kim said, the glitch for technology was that EEC was trying to get the payments out to the R&R so the R&Rs could pay. Is that right, Kim?
That's correct.
So that the R&Rs are kind of waiting for the money to come into the accounts, as Kim said, with the two different billing cycles. All right. There's a lot of
Amy, I also want to just be really clear that even though the new budget starts July 1st, 2025, that's fiscal 26, I don't want anyone to be under the impression that all of a sudden July 1st, we think the wait list is going to open up. Because
exactly.
EEC has to review the budget, look at where they are with the kids that are currently in care and the rate increases, et cetera. It's a whole process. So no one should be under the impression that the wait list is going to open up if the legislature puts money in for July 1st.
Right. So it's not like an automatic, oh, it's a new fiscal year. We suddenly
Right.
have, yeah, that would be nice though. Okay. Let me go, Sarah. Well, Brian had a question from the R&R's perspectives. What is the biggest gap in the systems of serving children with high quality care? And how do you see resolving that gap?
What is the biggest gap in? So I'm not sure if the I'm not sure what Brian, what you're trying to get at.
Well, kind of from where you sit as you're watching families try to come in, watching the state trying to get the money out, where do you see a gap or opportunity for action or advocacy or fixing the system?
well, I think the most obvious answer is in funding for staff. If the providers don't have staff, they can't open up classrooms. We've got 29,000 children on the wait list. I do not think that we have capacity to serve those 29,000 children, even if miraculously we got all the money we needed and we could fund them all. So we certainly need to address teacher compensation and getting more teachers and more classrooms and more capacity open. Kelly, Corinne, do you guys have other thoughts?
No, I think you're right, Kim, that they have to prioritize specific categories, and early educators are definitely one of those categories, especially since there was money supposedly in the line item last year for these folks, and now you have a lot of programs who were counting on this and it didn't come through, and it's really, really critical to get those teachers in the program so these programs can open classrooms that have had to close classrooms, which I think all of us across the state have seen center-based programs, closing classrooms. They just don't have staff. And even for, again, private pay families are also feeling this because they don't have places to put children if there aren't programs open. So,
Kelly, anything to add?
No, I think everything they've said, including, I think in my region, I can happily say that a high percentage of providers accept subsidies, but that's always going to be an issue also. But we've obviously done a lot, as well as EEC has done a lot to raise those rates and recruit providers, because of
Right.
course there might be quality providers out there who are not accepting subsidies. And obviously the more providers we can get into the system, the more likely we are to place any and all children in quality care. So.
Right. And Donna D says she's happy to hear quality. Anna Teresa says there are a lot of family childcare providers with openings. So I think this is my policy dream that we somehow can figure out like where the openings are, where families need care, where because I think sometimes it's hard to make sense of there's a wait list remember the wait list is for financial assistance. The wait list is not necessarily for a spot. So there may be a spot open, but you need a financial assistance to go to that spot. So I think that would be not to put it on the R&Rs, but like that is something I think that we need to figure out like where are the openings, where's it's like a heat map almost of like what does it look like? And
I
um
also, just to clarify one other thing, I think a lot of times we'll get a call saying, what number am I on the wait list?
right.
Usually the wait list, people want to know, am I number 20? Am I number
Yeah,
2000? And
sure.
this wait list doesn't have that because we have priority codes there. It's very complicated. The best
Right.
we can do for families is tell them the date and that they got put on the wait list, and tell them the date that we are working on, and you can have a little bit of an idea of where you might stand.
Right.
and I'll
Right.
just jump in because someone had asked about the overlap with contracted and
Yeah,
R&Rs.
that's a
And
good,
to
yeah.
Kim's point, this is another piece of that puzzle is that the contracted programs have availability to right families if they have an open slot. So potentially, if you're in a city or town that has a lot of contracted programs, you may be, and even though you're farther along on the list than your friend, if she lives in a city, I'll use Lawrence as an example, we have a lot of contracted programs. So the chances of a slot in a preschool opening up are that much greater than, say, in a town like Dunstable, where there
Right.
are no contracted programs. So there is that little bit of a difference, and that's where you have that contracted CCR and our overlap into what our capacity and availability is to write families from the waiting list.
Right.
So, so there is some movement based on what the contracted providers are seeing as far as families leaving. So that gives them that availability to write new families.
Right. I mean, this is why that local piece, like how many, knowing your own local kind of landscape about like how many providers, how many take subsidies, how many children, families there are. Well, Tom Weber kind of says it best. Thank you, CCR and Rs for all that you do. And that all is really a lot among the quiet heroes of Mass ECE. We know this was like a lot of information flooding. We know that there were questions, and you may still have questions about the wait list and all of that. But thank you, Kim. The slides are posted. As Kim said, please connect with the folks who are in the R&Rs in your region. You see the map. Because just like you want to build relationships with legislators, you want to build relationships with folks at the R&Rs while appreciating they also are having just like you, an incredible amount of work and workload. So be patient and assume positive intent. Okay, so Kim, thank you so much for joining us. If you still have questions or you want some clarification, you can email Kim, you can send me a message. I can get it to the R&Rs. So please, thank you everybody for joining us. We did record this morning, so you'll be able to see it on YouTube. We had over 115 people today, which was great to see. We will see you tomorrow morning, where we hear more about paid family medical leave. Thanks so much, Kim.